back to Kenosha Community Media, and I'm honored to have a great representative in the community, Guida Brown, the Executive Director of the Hope Council. And Guida, thanks for talking with us today. For those who don't know about the Hope Council, what is it?
We work to reduce the impact of substance use disorders in our community through education, referral, intervention, and I always forget one of them, prevention services. And we've been around for 50 years. We used to be the Alcohol and Other Drugs Council of Kenosha County. We primarily are known as the agency that if you live in Kenosha County and you get an OWI, you have to come to us to be assessed. So that's sort of our bread and butter, but we do a lot of ancillary services to serve our community.
All right. Well, the reason also I want to talk to you today is that we're in our stay-at-home order, and with the pandemic going on, are we starting to see a rise a little bit with alcohol dependency? Let's hear about that.
Certainly alcohol abuse, substance abuse. We have a huge problem. We already know Wisconsin's a lot of drinkers in the first place. We then had the governor with the safer at home order made liquor stores essential businesses. So just the PR move, the public relations move of saying, look, it's really important that we have easy access to alcohol, despite the fact that you can get alcohol a lot of other places in Wisconsin aside from liquor stores. And just that we are heavy drinkers in the first place. And so we are having huge problems with people who are drinking more than they should be, drinking at all if they shouldn't be, and causing a lot of problems for our hospitals. I know that early into this, Madison's detox hospitals were already at full capacity. And of course, the problem with that is that it reduces the capacity for other healthcare to serve people who may have COVID or who are being tested for COVID. So that's, and so that was sort of a double-edged sword as well. That was why they wanted access to alcohol, that we don't want people to go into detox so that they aren't filling our hospitals. But again, the fact of the matter is we have real easy access to alcohol. We didn't need liquor stores to be essential. So, but yeah, it's a huge problem. And it's not just alcohol, of course, there are other drugs, and it's across all socioeconomic lines. Stress is a killer, and people are going to go out and try to relieve that stress in any way that they can. Anecdotally, if you talk to somebody who sells, I happened to go into a neighborhood store yesterday, and she was telling me, the owner was telling me about how people go in there 4 times a day and buy alcohol, and it's really tragic. And again, that's what we're dealing with in our community. And because of the safer at home order, you have witness to that you didn't necessarily have in the past. A lot of people will drink in bars, and they drink in bars with people who are also drinking in bars. And so they're not seeing the impact on you as much as they are now when you're home with your family, or you're home potentially alone, which is another huge problem. I mean, so it is, it's a crisis, honestly. I feel like it really is a crisis.
Yeah. So when, if there is alcohol abuse going on, what should be the next step? Should, the family member call you, or what should be the next step?
So I've gotten a couple, your first defense, if somebody is really having problems with alcohol is one of the only drugs, alcohol and benzodiazepines, really the only 2 drugs that in withdrawal, that's what could kill you. Opioids cause a lot of pain in withdrawal, but they don't cause death typically. That's not to say that there couldn't be some extenuating circumstances, but they don't cause death during the withdrawal piece. Benzodiazepines and alcohol, you can die if you try to withdraw on your own. So if somebody's trying to stop drinking, if somebody has had a history of misuse and addiction over the course of time, now is not the time to stop. It really is not the time to stop. If somebody is realizing, oh my gosh, this is getting out of control, and and they're binge drinking, maybe, maybe it's only weekends. That doesn't mean you don't have a substance use disorder. Being able to control it on an ongoing basis is really the issue. And so somebody who only drinks on the weekends but drinks to passing out on the weekends still has a substance use disorder. They could stop on their own because they don't have that tolerance built up where they're staying in a constant state of drunkenness. So they can call us for resources. Again, that's part of the problem, Jason, is that the resources aren't as easily available. They're there. They're just, we've changed everything. So you call the Hope Council and no one answers the phone. I have to listen to the messages and call you back because we don't have a receptionist. We don't have an admin right now. Same for treatment facilities. I know that I just had a client who said, I've called this treatment facility 7 times and they're not calling me back. Well, because no one's answering the phone on a regular basis. So the service is there, the treatment facility is running, but we're doing things so differently, and it's really hard to adapt to that quickly. Same with 12-step meetings, especially this population. There's a theory, I don't adhere to it, but there's a theory that substance use disorder is really a lack of connection. And I believe that's a piece of it, but I don't believe that that's the whole thing. But the fact of the matter is that people need connection across the board. People need connection. And 12-step meetings are the place where you go and you connect with people who are like you. And now they can't do that. They're not being able to go into meetings and seeing people face to face. So they are switching to online, and that's a wonderful resource. But again, it's a huge change that has to be adapted to. So yeah, our first line of defense is identifying the problem and then reaching out for those services and figuring out what that person needs. But again, if this is an ongoing significant problem, now is probably not the time to fix it.
Yeah. Anything that the community in general can do to help the Hope Council?
Little patience is nice. We are here. We are serving our population. We have had to put on hold our testing. We do direct biomarker testing. We're planning on re-implementing that coming up in the next couple of weeks, starting in May. But really, I looking out for other people, making sure that this isn't, for the first time that I can remember, and it could be because I'm taking all of the phone calls, I actually had somebody who called and said, my friend is having an assessment today, and I want you to know this is going on, and this is going on, and this is going on. And to me, that was really helpful, because people come in and they tell us their story, and we don't necessarily get an accurate picture. So if I could say, yeah, but somebody called me and told me this, this, and this about you, and it's not narking on somebody, it's looking out for the well-being of a person you care about. Seriously, Jason, I think we all need to talk about uncomfortable things way better than we do. And one of those things is substance use disorders. People always say, well, it's none of my business. And I say, it is your business. It's your business because you care about this person, because this is a lethal disease. This is a chronic, progressive, lethal disease. The only end without help is death. I mean, eventually, we say incarceration or death, but the end result is going to be death. And if you knew somebody who had cancer, if you were even at the gym and you saw somebody with this great big mole that had, you, for whatever reason, you see this person's back every single day at the gym, and the mole grew exponentially over time, you wouldn't ignore it. That's not what we're made to do. We're made to say, hey, I know this is uncomfortable and I don't know you, but you've got this great big mole on your back. You really should get that checked out by a doctor. I've noticed over the course of the last month or so, it's really grown. We don't do that with substance use disorder. We say, well, that's that person's problem. It's none of my business. It's not this, it's not that. And I'm like, it absolutely is our problem. It absolutely is. I mean, just societally, it's taking such a toll. It changes our workplaces. It changes our healthcare system. It takes such a toll on our families. It's not one person's problem, and it's not one family's problem. So seriously, I would love for people to start getting involved in that and saying to people, hey, it's not judgment. It's not judgment any more than, hey, I noticed a mole on your back. Hey, I noticed that your drinking is negatively affecting you in these 3 ways. Or, hey, I'm really worried about you because I think that your drinking has gotten out of control, depending upon your relationship with that person. And for whatever reason, we're just afraid to do that. The other flip side of this as well is I've had a conversation with Judge Wagner where I'm stunned that people who are especially newly in recovery will be told by loved ones and family members, oh, come on, you weren't that bad, you can drink. And they're like, have you seen me? Do you know me? And Judge Wagner said, we're a society where if one piece of cake is good, two pieces are better. Like that's sort of our go-to. And so we don't want to drop down. We don't want to tell people, hey, and the problem with it is if I look at you and say, Jason, I think you've got a drinking problem, what's going to prevent you from saying, no, Guida, you're the one with the drinking problem?
Hmm.
So it's uncomfortable. And we know that there's a genetic predisposition. So if I'm hanging around with my family, chances are I'm not the only one in the family who's got a drinking problem. So there's that perception too of, well, I did just fine, or I only drink on weekends, or we really have to educate ourselves on what a substance use disorder looks like and how we can intervene on that.
And what are the harmful effects of excessive drinking or abuse of alcohol?
Yeah, well, your health, your life, your car, your privileges. I mean, just everything. It's just drinking alone. We know it has negative impact, even if you're a social drinker. And that's unfortunately in Wisconsin, we don't necessarily understand what appropriate drinking is. Um, so we talk about drinking that negatively affects your health. So it becomes harmful drinking for your health, not anything else. But for that to take effect, 1 drink per day for a woman and 2 drinks per day for a man are harmful drinking levels. Harmful. So I can drink part of a glass of wine, but every single day, if my habit is to drink 1 or 2 glasses of wine, I've moved now into the harmful effects. I've moved into cholesterol problems, heart problems, cancer. It causes cancer, particularly for women, breast cancer, it causes throat cancer. And that I'm not talking about I'm drinking excessively. I'm talking about if I am drinking 1 drink a day. And so here's the issue. We know that if you exercise 20 minutes a day, if you walk 20 minutes a day, it reduces your risk of cancer significantly. We don't tell people, we don't like go around and judge people for not walking regularly. We don't say, oh my gosh, you're so lazy. Why did you? We do that for people who have substance use disorders. And I don't understand that. They need help. They need help like somebody who's got a cancer or a diabetes, a progressive, lethal, chronic disease. And we don't have that same perspective. We're still trying to decide whether or not addiction is a disease. People are seriously still trying to have that conversation, which drives me crazy because I'm like, well, next up, we're going to talk about whether or not the earth is flat. It is so pointless anymore that it was determined to be a disease in the 1950s. It was actually first identified as a disease in the 1800s by Dr. Rush from Rush Hospital in Illinois. So you'd think that conversation would be over, but it's not over. Nobody is choosing to have a substance use disorder, having an addiction. So we have to recognize that. We have to educate ourselves, and we have to educate ourselves on what that looks like for me too. Again, not just for you. Can give you a personal example. My father had alcoholism, drank until he was hospitalized with cancer and died. My mother did not have alcoholism, but she worked really hard. She was a custodian for Kenosha Unified Schools. When she retired, so she retired at 65 years old. When she retired, she still continued in the same habit of getting up at about 4 o'clock in the morning. By the time I would get home from work at 5 o'clock in the afternoon, she would be smashed because she would have the same drink she was having. And she had woken up too early and she didn't eat, and she's getting older. Aging is a huge component of how substances affect us. And I was the one who had to say, hey, you shouldn't be drinking, what's going on? We shouldn't have a substance use disorder. She just didn't realize the habit she had gotten into. And so she stopped. Yeah, all right, you're right. I shouldn't be drinking, whatever, that beer or 2 beers or, that scotch and soda that I was drinking. And so she stopped doing that. And again, we grow into that all together, and especially now when we're seeing it in our own houses and may have the habit ourselves. A lot of different perspectives on that, but we need to be able to tell people, hey, this is not okay, this is not healthy. And again, it's not a judgmental issue. It's, I care about you and I don't want you to die. And we don't do that. We feel like we're judging people, and we're afraid to say that.
All right. Great information, Guida. We thank you so much for talking with us today. For more information about the Hope Council, website, Facebook, phone number.
Yep, hopecouncil.org. Council is COUNCIL. We are on Facebook, Hope Council on Alcohol and Other Drug Abuse. And our phone number is 262-658-8166. And you can reach us by email at info@hopecouncil.org.
All right. Well, Guida Brown, Executive Director of the Hope Council, thank you so much for talking with us today, and thank you for connecting with us today.
Thanks, Jason. I appreciate it.